So once again, good evening, everyone. We want to welcome you and thank you for joining us today. We're going to start immediately. It's an hour with the cardiologist. Today is the 26th day of October, 2025, and we welcome you. We want to believe that it's going to be as informative as possible and we'll also make it as interactive as possible. Um, and I'm not alone. I have other cardiologists that will be sharing their experiences with us, and I'm sure that we will also have opportunity to ask our questions and to, interact and, you know, make it a very rich session. So you're welcome. Let's start immediately. So we'll be looking at hypertension and its many challenges, part one. I'm Akinsanya Olusegun Joseph. Now, we're going to make it as simple as possible, and that will also give opportunity for us to be able to digest and understand what we're saying in a very concise manner. And after that, we will give room for questions and answers, interactive sessions. These are my outlines. Introduction, the challenge of diagnosis and monitoring, blood pressure. The nature of hypertension itself is a challenge. The challenge of management, challenge of control of blood pressure and control of hypertension, challenge of comorbidities, the socio-economic challenges, and the challenge of complications. Of course, we will not be able to finish everything today. Very likely we'll consider one or two of these and then give room for interactive session. By way of introduction, hypertension remains a very challenging entity from diagnosis to monitoring and management. It is the number one risk factor for cardiovascular disease, for cardiovascular events. It's the number one leading factor for stroke, for heart failure, for heart attack, for kidney failure. All right. And it's something we need to deal with. The challenges are universal. They are not restricted to any race, age, gender, or socioeconomic class. The need for more enlightenment, therefore, cannot be overemphasized. And the reason why we do this is because as we get more knowledge about hypertension, it's unfortunate that the entity is still raging, and a lot of people are still coming down with complications, still coming down with a lot of, avoidable things. And that is why we feel that we need to constantly educate our patients, educate the public, so that we can, in our own way, reduce, the impact, the negative impacts of hypertension. Okay, so hypertension is sustained elevated blood pressure. We've said that over and over again. So usually the blood pressure must be elevated at least 2-3 times before you label somebody as being hypertensive. All right. And WHO puts the blood pressure cutoff at 140 over 90 and above. 140 over 90 and above. Both numbers are important, please, because we still find people that if you ask what's your blood pressure, they say my blood pressure is 140. Oh no, 140 over what? Because if you say 140, you have not, given us the full reading of the blood pressure. The upper one is the systolic blood pressure. It's very important. The lower one is the diastolic blood pressure. It is equally important. And so to mention one figure and leave the other um, is not good enough. And what it means is that, the one that is neglected, you won't put an eye on it and it can be high. And usually the lower one tends to be high, in the young and middle-aged people. All right. The systolic, which is the upper number, the upper value tends to be high in the elderly. And so if you just say my blood pressure is 120, if you don't keep an eye on the lower one, it could just be 120 over 100, 120 over 95. And because you have not thought it important to look at the lower one, the lower one may just be high. There's what we call isolated diastolic hypertension, the same way as we have isolated systolic hypertension. So sometimes both numbers may not be high at the same time. For the elderly, if they're going to have any isolated one, is likely to be the systolic, which is, the higher value, the higher number. So they may have something like 150 over 80, 165 over 85 over 80, and things like that. Isolated systolic hypertension. On the other hand, for the young and middle-aged people, they tend to have isolated diastolic hypertension. If they are going to have any one of them, that is going to be isolated. If both will not be high, if both are not high, the one that is more likely to be high, and I'm sure that some of our, participants on this call, this webinar, can attest to it. That sometimes I hear the young and the middle age people that are living with hypertension tell me, oh, doctor, it's the lower one that is usually high. So both of them are important, please. WHO puts it at 140 over 90 and above. And if you live in the US, the cutoff for hypertension is 130 over 80 millimeter mercury and above. All right, 130 over 80. All right. As simple as this is, diagnosis is usually very much challenging. And the reason for that is people hardly check their blood pressure. When they check, sometimes they don't check it correctly. So hypertension can only be diagnosed by measuring the blood pressure. That is as simple as that is. Hypertension can only be diagnosed by measuring the blood pressure. In other words, if you don't check your blood pressure, you can never know whether you're hypertensive or not, whether your blood pressure is elevated or not. Unfortunately, not many people check their blood pressure. Therefore, diagnosis is usually delayed most times. More often than not, by the time people are coming in with, that reality that their blood pressure is high, by the time you check other things, you find out that it's not only high, there are other things that are coming in. The heart is probably enlarged. Okay. The ECG is showing some abnormality or the other. Okay. The chest x-ray shows enlarged hearts. Maybe they are having palpitation, and things like that. So because people don't check their blood pressure regularly, diagnosis is usually delayed. By the time they're coming with, what we call hypertension mediated organ damage. Okay. For those who are joining us for the first time, we've done quite a number of series on hypertension, so you can go through it on our YouTube page. Just type an hour with the cardiologist, and it will bring out for you the things we've done so far, and then you can listen to them, you can watch them. Furthermore, a number of people measure their blood pressure incorrectly. You know, so it's one thing not to measure the blood pressure at all. It's another thing not to measure it correctly. So we will take us through, how to measure our blood pressure correctly. That's part of the thing that we're going to do today. Because if we can get this challenge of diagnosis and monitoring right, we would have solved a lot of the dilemma with regards to blood pressure, blood pressure checks and monitoring of the values. And by extension, we will be impacting positively on those who may be hypertensive. Very, very important. And so that's going to be the crux of today's webinar. All right. Now, how do you measure the blood pressure? BP is measured by using sphygmomanometer and a stethoscope. Okay, it can be the mercury sphygmomanometer. This is going out of fashion now, although some people still use it. The aneroid sphygmomanometer, and then the digital. We're in the digital age, so you have the digital sphygmomanometer. All right, and it must be properly placed. It must be properly placed, and then must be checked the right way. All right, so the sphigs are important. All right. Blood pressure is not checked by touching the head. I mean, some people say, "Ah, your pressure is high." You look and they touch the head. No, please. All right. You can know whether somebody has fever by touching the body, touching the head and things like that. And if it's hot, yes. But even at that, you need to check the temperature. Okay, by using a thermometer. All right, either digital one, or the one we put underneath the armpit. So for blood pressure, you must use a sphygmomanometer. All right, and I would encourage everyone to get a blood pressure measuring device, digital sphygmomanometer. All right, and at least check your blood pressure on your own. Let's quickly look at how to check the blood pressure correctly. Because if you don't check correctly, you can have, false readings, and that will not be a good thing for you. So, number one, make sure you are not having any conversation while you are checking your blood pressure. Because actively talking or listening can add up to 10 millimeter mercury to that blood pressure, as simple as talking is. So you see some people, they are checking their blood pressure, they're on the phone. Yes, what are you talking about? How are you? It's going to impact on the blood pressure. All right. The phone rings, they want to quickly grab it. No. Let the phone ring. Check your blood pressure. After checking, then you can call the person back. Support the arm at level. All right, because an unsupported arm can add up to 10 millimeter mercury to your blood pressure. All right, put the cuff on bare arm. Thick clothing add up to 5 to 50 millimeter mercury. All right, so let it be a bare arm. If you're going to the clinic, try to wear, some form of loose clothing. Okay, loose top, such that you can fold the 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 sleeves of that shirt, of that blouse, of whatever the cloth you're wearing. Otherwise, you may need to to remove it altogether for you to get for them to get an accurate reading for you. All right. Now, use correct cuff size. That is also very important. If you use too small a size, it can add up to 2 to 10 millimeter mercury to your blood pressure. And if you use too loose a cuff, it will reduce your blood pressure. You will have falsely reduced blood pressure, and you'll be celebrating, this my blood pressure is okay now. Whereas, the cuff you have used is too big for your arm, and as a result of that, you're not, getting the accurate measurement. All right. So, correct measurement of blood pressure is a challenge, and can be a challenge to somebody who, for one reason or the other, does not measure correctly. Support your feet. Make sure your feet is not dangling. Okay, make sure it's on the floor. All right. If you are not lying down, make sure you sit and let your feet touch the floor. Unsupported feet adds up to 6 millimeter mercury to the blood pressure. So please make sure you check your blood pressure. Put your feet on the ground. Keep legs uncrossed. If you cross, some people, they want to check their blood pressure, they're crossing their legs. No, it can add up to in between 2 to 8 millimeter mercury to your blood pressure. So please make sure you uncross your leg. All right. And if you are pressed, go empty your bladder first. Go and urinate first before you check your blood pressure, because a full bladder can add up to 10 millimeter mercury. So here, some people, they get to the hospital, say, quickly check my blood pressure before I go to ease myself. No, ease yourself first. All right. And after doing that, even rest for about 5 minutes, okay, before you check your blood pressure. And then make sure your back is, against the cushion, or against the platform. Okay, support your back. Unsupported back can add up to 6 millimeter mercury. Some people, they sit and then they lean forward. No, that's not the way to check the blood pressure. That will add to your reading. All right. So please, let's make sure that we check our blood pressure the correct way, so that we can have, as much as possible, correct readings. All right. 46% of adults with hypertension worldwide are unaware that they have it. That is a challenge. That is a challenge, and this is coming from the from WHO. Is a challenge. Okay, and we have said that hypertension is one of the major causes of premature death worldwide. It cuts across, and is not noticed if symptoms are not felt and the test is not done. And more often than not, symptoms don't come immediately. All right? Symptoms don't come immediately. And that you have no symptom does not mean that your blood pressure is not high. So those who say, I know when my blood pressure is high, and they don't check their blood pressure, you are not helping yourself. Please check your blood pressure regularly, especially if you are hypertensive. Please check it regularly. It's yours. It's your health. Check your blood pressure. Don't wait until you go to the clinic. If you can save up to buy the apparatus, please make sure you do. It will help you. All right? Because, 46% of people globally are unaware that they have hypertension. And this even varies from place to place. In this part of the world, it's over 50%. Hypertension on awareness is far more than 50% in our in our in our community here in Nigeria as a whole, and it also varies from place to place, from region to region. All right. So this is very, very important. We did a study in a place, I think 2021, 22, thereabout. And among the people that, that were, hypertensive, only 19% knew that they had hypertension. 81% of the populace. And this was not just a small distance from, place to place. 81% of those who are hypertensive never knew. Okay. And of course, some of them, have even started having complications. So it is important that we check our blood pressures, please, so that we can diagnose this on time. And, one other thing is that, hypertension is increasing. The number of hypertensive patients increased by 100% from 1990 to 2019. That's huge. This is WHO. It's not just one cooked up stuff. All right. And over 1.28, and that has even increased to about 1.36 billion people, living with hypertension worldwide. And more than two-thirds of these people are in low and middle income countries where Nigeria belongs. All right. So it's very important that we know this. It's very important that we check our blood pressure. In Nigeria, the prevalence of hypertension is, between, 27% to 49%, more hovering around 35, 34, 36, depending on the regions that, the studies were conducted in. What that means is that for every 10 adults in Nigeria, 3 will be hypertensive. Between 3 and 4 will be hypertensive. That's much. That's huge. And that should make us to check our blood pressure, should drive us, should, encourage us. I'm going to check my blood pressure regularly. And if there's a family history of hypertension, then the risk even increases. The risk of, another person in that family having hypertension increases. So if you have a family history of hypertension, you should check your blood pressure regularly, even if you are not hypertensive, so that if anything, wants to go out of the way, you can diagnose it on time and you can treat on time. It's very, very important for us to know, please. Many people live in denial. That is another major challenge. It's not my portion. It's not my portion syndrome. We're not saying it's your portion, but if your blood pressure is high, deal with it, please. It's not my portion. I reject it. I do this. I do that. Will not help anybody. It has never helped anyone. Deal with it, please. All right. And that's not saying that we do not believe in the power of God. Doctor, are you telling me that God cannot? No, I'm not saying that, please. But I am saying that be real. Check your blood pressure. If it is high, seek help. Very, very important. Very important. All right. Now, this is when we talk about hypertension, one of the things that it affects is the heart. And even the Bible says it, guard your heart with all diligence, for out of it are the issues of life. You've got to take care of yourself. What you need to do for yourself, God will not come and do it for you. So please, let's make sure that we check our blood pressure and don't live in denial. This thing is very easy to control, very easy to deal with. Okay? But because those who live in denial will not likely, adhere to lifestyle, modification advice, And of course, they will not take their drugs regularly. I still met with, you know, someone today, just randomly, just check the blood pressure, and blood pressure was 155 over, I think, 88 or 91 or something like that. Okay. Why? He says, I've not been taking the blood pressure. I've not been taking my drugs. I mean, living in the, I just want, a lot of people have a lot of excuses for this. So please, let's not live in denial. Okay. And again, hypertension can only be monitored by checking the blood pressure. And unfortunately, many people hardly do. All right. They just live on, live and let's live. No, check your blood pressure, please. It's very, very important. Even if you are not hypertensive, periodically check. As you advance in age, we have looked at it before. You can go to hypertension 1, 2, 3, 4 that we did. So, I think that was last year. All right. And then we just finished, hypertension beyond numbers. You can also go through those ones. You will see, the importance of checking your blood pressure. Because if you don't check, you won't diagnose it. And if it is not diagnosed, it will not be treated. And if it is not treated, there is only one pathway, is the pathway of complication. Only one. Only one pathway. It is the pathway of complication. Unfortunately, sometimes premature death, sudden death, and the rest. But we don't want that. We want all those kind of things to stop. All right? When BP is not checked regularly, the chances of controlling it is drastically reduced because you will not know. You will not be bothered. There are people who, even symptoms are knocking at their door every time. They are having incessant headache, yet they keep taking paracetamol and treat little malaria, little typhoid. They will not check their blood pressure. Please check your blood pressure. For some, they will be having sleepless night. They'll very poor sleep, turbulent sleep. They won't check their blood pressure. They'll be taking sleep mixture and sleep medicines. Yes, we know that poor sleep can cause your blood pressure to go up. Poor sleep is a risk factor for hypertension. But on the other hand, and this is very, very important and, very true. If your blood pressure is high, you will not have good quality sleep. I mean, a person cannot have a blood pressure of 200 over 110 and sleep soundly. It's not possible. It's like the house that is on fire. You can't sleep there now. You've got to quench the fire. All right. So it's very, very important. Let's check our blood pressure regularly. Let's deal with this challenge. All right. And things will go well. Hypertension or high blood pressure is a major cause of premature death worldwide. People with hypertension may not feel symptoms. The only way to know for sure is to get your blood pressure checked. This is WHO African region. All right. And of course, for us in this part of the world, hypertension is diagnosed when the readings, are 140 over 90 and above on two or, or more, different, occasions when you check the blood pressure. All right. So it's very, very important. And it's important that we have our blood pressures checked regularly. No symptoms does not mean normal blood pressure. Please, let's note that. No symptoms does not mean normal blood pressure. That's why it's called a silent killer, a silent disease. Everything can be right, everything can be okay. You can, have it can be doing well. We have patients that come in, we check the blood pressure is 195 over 100, over 110. And you say, no, and they're like, doctor, what's this? I came myself, I drove myself, you know. there's no problem and this and that, but there's no problem does not mean there's no problem. And by the time you begin to do the more qualitative thing with regards to their health, you do their ECG, the heart is enlarged. You do their chest X-ray, the heart is enlarged. You do this is going wrong, and still no symptoms. We'll deal with that more in the next edition. Okay, so no symptoms does not mean normal blood pressure. That is a challenge for somebody who may not want to check the blood pressure, who may say, oh, I know my body. Few patients that will come that will say, oh, I know my body, I know my body, I know when my blood pressure is high, my body will be doing me one kind. Your body may not do you one kind. And by the time your body is doing you one kind, that blood pressure would have been high for a long time that you never knew, for hours that you never knew, for days that you never knew, for weeks maybe that you never knew. So please, let's take responsibility, let's take ownership and check our blood pressure regularly. Okay? Now, it's also important that we know, I mean, this is coming from the UK now, get regular checks and know your numbers. I mean, we always say, know your numbers, know your numbers. All right. And let me just quickly go through this with us. I love this that is put here. All right. So the blood pressure, if your blood pressure is 90, less than 90 over 60, it is low. We call that hypotension. We've dealt with that also in one of our, webinars, so you can go through it on your own. The ideal blood pressure 120, let know between 90 to 120 over 60 to 80. All right, that's the ideal blood pressure. So if your blood pressure is around this range, it is good. Now, another thing I need to say is that sometimes when people start taking the drugs, well, we will deal with that later on. They say, oh, doctor, my blood pressure is low. My blood pressure is low. Okay, what's your blood pressure? 100 over 70. That's not low. You have been used to 190 over 100 or 160 over 95 does not mean 100 over 70 is low. That's ideal blood pressure. So if you're doing anything to keep the blood pressure at that range, keep doing it. Keep eating right. Keep taking your blood pressure medicines. Keep, adhering to lifestyle modification. Between 120 and 139 over 80 to 89, we say that the person has hypertension, pre-high blood pressure. So that person has pre-hypertension, all right? And then from 140 and above, over 90 and above, we say that the person has, hypertension. So please check your blood pressure regularly, okay? Because it's very, very important. However, if you're checking at home, the blood pressure target and cutoff for hypertension is lower. It's by 5 millimeter mercury lower. So we say if it's in the day, we say less than 135 over 80. We say over 85. All right. So less than 135 over 80, is what we look out for. If it's 135 over 80 and above, we say that person, has hypertension, has elevated blood pressure. The blood pressure is high. And in the night, the figure is also different. I won't go into that now so that we don't we can stay on a page that will not confuse people. But in the night, the blood pressure is lower. I think I even need to mention it, because if you check your blood pressure at night and it's 100 over 60, 100 over 65, it's still normal. The normal cutoff for blood pressure or elevated blood pressure in the night is 120 over 70. So 120 over 70 and above, we say that blood pressure is high in the night. All right. So if you check your blood pressure at night and it's hitting 130 over 85, that blood pressure is still high, please. Okay, you need to get to your doctor. All right. And then of course compare it with your afternoon morning use. Averagely, the blood pressure of 130 over 80 and above is high at home. All right, if you're measuring at home. The 140 over 90 is office blood pressure. That is clinic blood pressure. Okay, so we need to know that. The benefit of using a BP monitor cannot be overemphasized. It's a key tool for managing your health. Number one, it will help you to track your blood pressure and help you to know how well you are doing. It will help to quickly detect hypertension if there's any. So it's extremely important. Again, there is no way by which you can diagnose hypertension if you don't check your blood pressure. Your blood pressure measurement is important. And hypertension is one of the major risk factor for death globally. It is also one of the major risk factor for premature aging globally. It's one of the major risk factor for sudden death globally. And the tools for diagnosing and monitoring it is very, very easy. It's very cheap. I mean, this is not invasive. You just put this stuff by your arm and you check the blood pressure. Nobody's cutting you. It's not surgery. It's not one highfalutin thing. Let's check our blood pressures regularly. It prevents complications, and of course, it encourages lifestyle changes. Because if you see that your blood pressure is always high or around that periphery of being high, you want to actively do something. If you need to cut down your salt, you want to do it. If you want to quickly do something. So it encourages lifestyle changes as well. So please, this week, make sure you check your blood pressure. If you've not been checking, and let's start checking our blood pressure regularly. All right, before we end, I'll just play this for us to summarize, how to check your blood pressure regularly. So prepare rest, avoid substances, stimulants like caffeine and the rest. Sit correctly, your arms well rested, your legs on the ground, correct cup placement, turn on the device, start the measurement. Wait for display, note the numbers, record your blood pressure. Avoid talking while you're checking. No tight clothing, very important. All right. And then go ahead and record the blood pressure. Very, very important. We'll stop here for today. I decided to go through this because if we can get this challenge out of the way, we will be solving a lot of problems. We'll be dealing with a lot of issues with regards to blood pressure measurement, with regards to hypertension management. If you don't check the numbers, if you don't check your blood pressure, you will not know how you are doing. And if you don't know how you are doing, anything can happen. So let's stop here for today. Thanks for listening. God bless you. So we're going to give room for questions and answers. We have 11 minutes to interact. Actually thought that So I want to believe that we've gotten something for today. And if you have questions, comments, you can go ahead and ask your questions or make your comments. I know there are questions on the chat box. Host, can you help me unmute Dr. Doye? Let him just contribute and tell us one or two things with regards to his own practice. Dr. Doye, you're welcome. And you can help me unmute Decolade as well. Yeah, good evening.
Just a summary of what we've heard today. It's important to take our drugs, and also more importantly, it's good for us to check the blood pressure, and the essence of that is to be able to have an accurate reading with regards to whether the BP is high or the BP is low, such that we'll be able to make appropriate adjustment by also visiting our doctors. So when you take your drugs and you have your BP machine at home, it's good to also record those values. So let's assume you take your drugs in the morning. So when you wake up, before you take the morning dose, it will be appropriate to check those values and have a small booklet where we can write these values, such that when you go for your visit to see your doctors, it helps them to know when to make some adjustments, whether to add more or to take some from your medications, and then helps a better management, basically. So I will just encourage us to make sure we have the BP apparatus. It goes a long way to make the job of your physician easy in their monitoring your blood pressure. Thank you.
Okay, thank you very much, Dr. Donye, for that succinct wrap up. I think we have some questions on the chat box. If you want to ask your question, you can, and you don't want to put it on the chat box, you can raise your electronic hand so that we can attend to your question. The host will unmute you. All right, but maybe we'll just quickly run through the questions on the chat box. Some of them have been answered. Okay, good evening, doctor. Thank you so much for this. I'm very grateful. Remember, okay, thank you very much. In a situation where readings averages 85, 55, 55, 87, 55 for some days while taking the medication, what's your suggestion? Okay, fine. Let me just quickly take that. So if your blood pressure is 87, 55 is low, all right, I will advise that you get back to your doctor. Step withhold taking the drug for that period. If you can quickly get an appointment with your doctor, that will be fine. All right. But please, if for any reason you are not able to get, an appointment with your doctor, what you can do is to reduce the dose of what you are taking. First of all, you can skip for 1 or 2 days, keep checking the blood pressure. Because what happens is this, usually if you're hypertensive, if the blood pressure goes down this low, all right, if you just throw all the drugs away, let's assume that you are using 2, 3 drugs, all right, and maybe their maximum doses. If you drop all of them, it's a matter of days, the blood pressure will shoot back up. So if you're not able to get your doctor, try and get in touch with anybody in that facility who can quickly get across to the doctor for you. All right, and then they can help you to adjust the dosages. So, for example, if you're taking a drug of 10 milligrams, they may reduce it to 5 or even 2.5. You're taking a drug of 160 milligrams, they can reduce it to 80 or even 40 and things like that, and help you to get a good balance for your blood pressure. But if consistently, it's going low and low, and you are also optimizing lifestyle changes. Yes, it is possible for very few, especially when they have mild hypertension, to control the blood pressure with lifestyle changes alone. All right. But those that fall into that category are very few. All right. There are up, up to date. They are running with their lifestyle changes. They cut down, on salt. Not that they don't take, they reduce it to the barest minimum. Low salt, not no salt diet. They reduce their weight. If they are obese or overweight, they shed weight. They do exercise regularly. They eat right. They take veggies. They take, fruits. They take nuts and things like that. You know, and that helps. All right, and gradually they can, be taking off drugs for those who have mild hypertension, and then the blood pressure can be managed, with lifestyle changes. But trust me, it's not everybody that will hit that. Somebody who is using four drugs and the blood pressure is still 160 over 100, 50 over 95 is not likely, you know, to be able to get to that point. All right. Except it takes, very drastic lifestyle, modification and pathway. All right. And even at that, keep checking your blood pressure, please. Very important. Do we need to book an appointment or we can just walk in? There are numbers that are displayed. You can just call those numbers. They will help you with that question. They will assist you with, booking an appointment if you want to, sir or ma. All right. Thank you, doctor. My diastolic is not going down even after taking the medication regularly. Still have 128 over 169. Okay, I think it's been answered for us. Dr. Daniel have dealt with that lifestyle modification, and then get across to your doctor. He or she will help you, to scale up on your drugs and things like that. Good night and have a wonderful night. Okay. Can someone with a normal blood pressure of 120 over 70 still run the risk of heart attack or heart failure? Dr. Donry, do you want to help with that, please?
Yes, sir. Just a minute. Okay. Trying to answer a quick question. Okay. So the answer is yes and no. Yes, in the sense that, or let me say, having a good blood pressure can give you some form of protection against having heart failure or heart attack. But hypertension is not the only risk factor that can make an individual to have heart failure or heart attack, as the case may be. So hypertension is the commonest in our environment. People who have heart attack too, okay, can also be susceptible to having a heart failure over time. Then diabetes is another risk factor. Use of alcohol is another risk factor. There are abnormalities of the heart, muscles of the heart that we call cardiomyopathy. So for those who have those abnormalities, despite the fact the BP is normal, they might still come down with heart failure. But looking at hypertension as a cause of heart failure, you are protected to a reasonable extent if you take your drugs regularly and you have a good BP control. But we should have it at the back of our mind that there are other risk factors like obesity, like diabetes, like I said earlier on, and those genetically inclined heart-related issues that could also make people susceptible to having a heart attack or heart failure, as the case may be. So I hope this was able to answer those questions. Thank you.
Thank you very much. And then smoking as well. Smoking, sedentary lifestyle, illicit drugs and things like that. Increased cholesterol diets, yeah, all that things. But hypertension, like the doctor has said, the main, the commonest cause. Somebody is asking, which hand should we use for blood pressure measurement, left or right? You can use either. But usually, what we tell people is at the very first time when you're going to check your blood pressure, check both left and right. Take the number that is higher. So if you check the left and it is 120 over 80 and you check the right and it is 130 over 80, record that 130 over 80. All right. And then you can use the right more than the left. Use the arm that gives you a higher figure. That will help you, to be proactive enough, to deal with anything that needs to be dealt with when it comes to, your blood pressure control. Any chances of permanent reversal after some time? Well, this is interesting. Hypertension can only be controlled, is not cured. Primary hypertension, and that's what we're dealing with. But if it's even secondary hypertension, you can deal with the primary cause. For example, if somebody has kidney problem, if you treat that kidney problem well, you will be sorting out the issue of the high blood pressure. If somebody is suffering from hyperthyroidism, that's hyperfunctioning thyroid, if you can deal with that, then you will be solving the problem. But studies have also shown that the patients are not completely off the woods, because you need to use drugs to deal with that hyperthyroidism. And if you do surgery, then hyperthyroidism to hypothyroidism, you may need to, make the person to still be on some other drugs. So, but permanent reversal control is what is advocated, all right, as much as possible. But if there are things like morbid obesity, for example, and the person is able to really really drop down, then the need for drugs may also go out of the way. As the weight is being shed, the need for drugs may also decrease. But please still keep an eye on your blood pressure. How often can we check? As often as you would want. You can check daily. You can check. Okay, I think so. I think it's been answered. Okay. You can check before you take your medication. After you can check at your own convenience, really. All right. Please, host, help us unmute Akin Bolas to ask his or question. We're rounding up. It's already 8 o'clock. I think this is the only question we will take. We'll go to part 2 next month, and will let us know when that will be. Host, kindly help me unmute Kimbolas. I'm sure you must have been given the opportunity to unmute Salma. You can just click the mic button and you will be
Thank
able to
you.
address.
Okay. Thank you, doctor. I just want to find out how often can we check it at home, and what time is proper to check the blood pressure at home.
Okay, I think I thought we just answered that. You can check, at your convenience. If you are hypertensive, once daily is fine. If you can't keep with once a day, you can do once in 2 days thereabout. And I tell patients, you check it at your convenience. But if you can check in the morning, that will be fine as well, because there's what we call early morning surge.
Okay.
So if you can check early in the morning, that's also very good. And occasionally you can check at night as well, because there's also what we call nocturnal hypertension. All right, just to be sure that the whole day is covered. But of course, do it at your own convenience. All right. So I think I'm not sure there's any other question. Um, I think we will be rounding up now. If you have any question, any other thing you want us to deal with, you can let us know. We will deal with that, and then of course you can um, reach out to the number that is on the chat box. For other things you want to be added to the WhatsApp platform, reach out to the number so that they can add you to the WhatsApp platform for this particular program. And of course, periodically you will get updates from us. You will also get, educative materials from us. All right. We're going to end now. Thank you very much, everyone, for your rapt attention, for listening and everything. If you have gotten value for your time, you can just put it on the chat box for us. Let's be sure that we have not wasted your time. Uh, Okay, host, please help us to, paste the number, put the number on the chat box again. Someone just posted that you can't see the number. Please put the number again. How often can we check at home? We have answered that. Okay, please help us put the number. Thank you very much, Brother. Thank you very much, sir. Okay, so the numbers are there now for us to see. You can copy them, and you can contact the you can make a call to ask your questions, and then clarify whatever issues you want clarified. Thank you very much, everybody. Have a wonderful health field and a fruitful week ahead. God bless you. Thank you. Thank you very much. Your phone number is on the chat box, please. Just scroll up, you will see it. You can copy. Okay, it's been posted again.